Broadcasting from Watts Creative Studios and live on Grove Street FM. You're listening to Talk Local to Me, brought to you by the Central Virginia Business Coalition.
Good afternoon, everyone, and welcome to Talk Local to Me with your hosts, Heather Alto.
And Mike Norfield.
So we're so happy that you're joining us again today. And we are really excited to be bringing back our guests to the podcast. They were on a few weeks ago with us.
It was a good podcast.
Yeah. Dr. Anderson with Kaya Health. How are you? I love it when I do that right when he's drinking.
Oh,
he's
you
taking
got
a
me.
sip of his drink.
I'm doing great. I love the summertime.
Yes, me too. So I just got back from a nice, relaxing vacation. And I'm actually going away again this weekend just for a quick weekend getaway. Yes.
World traveler.
I know. Well, here's the thing. My husband and I got tickets to see Chris Stapleton in concert.
Oh.
And
cool.
it's Friday night. So we're leaving Friday afternoon and we were going to stay in Virginia Beach. But Virginia Beach is really expensive this time of year just to stay for 2 nights, to go. And his dad lives there, but he doesn't want to stay with his dad for some reason. I don't know. But
I get it.
So we decided we can get to go to Nag's Head this year, which is like our normal vacation spot.
Right.
So we're going to jet down there for 2 days.
Oh, you're going to jet? You're going to take your jet?
No. Well, yes, my private jet.
Private jet?
That I borrowed from Woody.
I got you.
No. But so I'm going to do that. But I love the summer. It's
And that's a great concert too, Chris Stapleton out here.
I'm hoping.
I'm distantly related to him.
Really?
I am.
Can you get him on the podcast?
It's my brother-in-law's dad's cousin or something.
Twice removed?
Yeah, it's distant, but it's there.
Okay.
So my mom refers to him as Cousin Chris all the time. And we're like, you've got to stop doing that. That's ridiculous. But
I can see your mom.
here I am telling the story though. So I guess it's not that silly. But
Yeah.
But yeah.
So we're gonna be talking with Kaya Health today, and about I want to kind of reiterate all the things we talked about last time for anyone who maybe didn't wasn't listening to that show and is listening now. And I know we had people that were listening in that really got a lot of good information from it.
Yeah.
And then we're going to be talking. They have a new provider, and we're going to be talking about some stuff that the CVABC is going to be doing with Kaya Health in the latter half of this year, and lots of good things coming up. But before we dive into it, I do want to mention a few things we have coming up, and a lot of things we have coming up, quite actually.
One of those things is related to today's podcast. We have a health fair and disc golf tournament, August 5th.
August the 5th, we do. It is our fall fling. And it is a healthcare fair. I say healthcare, it's kind of a health and wellness, and it can go basically anything that has to do with your health, whether it's through medical, dental, orthopedic, home care, visiting angels, chiropractic, physical therapy, financial wellness, any of those sorts of things. We even have like a martial arts studio that's going to come out and have, cool. Things for the kids and nutritionists. And so it kind of runs a really big, gamut. So it's going to cover lots of community. We really want the community to come out to this because I think there's kind of I don't want to say a deficit, but I think in lots of different communities, I don't think they always know what's available to them. And so we want to kind of use this as a platform for people to come out and meet providers and businesses that they could potentially use throughout 100%. The year.
When I go out and see people for Visiting Angels and they want to learn about us, like I spend more time talking about home health, like physical therapy, occupational therapy, different programs in the community and things like that, because people just don't know. Like if you're a veteran and you served in an active war, you can get home care through the VA, different things like that. Mm-hmm. Like there's adult support groups that you can go to, like Raspberry Hill, things like that. Harmony Day Support maybe included in that. Programs like that, and people don't even realize that there are other options out there. So I think there is a huge deficit in learning what is out there and available for people just on a day-to-day basis.
And we're going to have food trucks. We're going to have...
All right.
I know, right? I just got to figure out which ones. But I'm trying to veer towards like healthier option food trucks because it's a health and wellness fair.
Is Cuba's pup truck thing?
She might be coming. I'm not sure. I know she's coming to Battle of the Bands, but I don't know if she'll be at the health fair.
Okay.
And I know we'll have some kids activities. And then, like I said, the disc golf tournament goes on at the same time because it's at Falling Creek Park here in Bedford. Like Mike said, it's Saturday, August the 5th from 10 to 3. And we have the disc golf tournament is at the same time, same place, just on the disc golf course. And I feel that's going to probably sell out. So
It went crazy last year because
we sold
because
out.
of the weather, the health fair had to be canceled. But
a hurricane came through.
the disc golf came through, and we had people showing up and wanting to play, and even in the weather. So
well, last year we held it in October, which is hurricane season, and so of course we got hit with something. So but you would not. It was crazy how many of the disc golfers came out. Still played in the wind and the rain. And then we had people that weren't even registered coming that said, well, we heard y'all's was still going on, but ours got canceled. So can we sign up for, can y'all fit us in? And it was nuts to me. I was like, this is hardcore.
Wow. So in the disc golf tournament, is there, because I know like the putt-putt thing in the past, the putt-putt tournament, putting for a cause, that you could buy mulligans and things like that. You need a chiropractor to sponsor a slip disc. If they accidentally throw the disc wrong.
I need that.
Look at that.
I like it. Yeah, we do have hole sponsors, of course. We do 20 holes that we do that for. But that's a good one.
That is a good one.
I'm have to, actually, I have a chiropractor that's getting ready to sign up. So I'm going to throw something at him.
Yeah, like, hey,
throw something at him.
Do your slip disc. There you go. Where you started this, Andrew.
This is clever.
Yeah.
So. But yeah, that would be a great thing. Yeah. And how much is it to be a hole sponsor of that?
$100.
Okay. And how many holes do you have left?
20.
20.
Because we haven't even started really.
You haven't started. Okay. So if you listen to this podcast and you call today, you can get premium hole sponsorship.
And part of that whole sponsorship, I mean, you get your sign at each hole, but we use that because each for those, I'm learning the disc golf like jargon, the whatever, but like so there's things called like CTPs, which is closest to the pin.
Okay.
To closest to the something.
Pin sounds good.
Sounds good to me. Closest to the something. And so with that, you have to, you give away something to the person that is closest. So we use that money to help get those gifts and things like that.
Excellent.
It's so fun.
So no hole in one with a Cadillac kind of thing, but
actually there is an ace pot. So there is a hole in one. And then the Dynamic Discs who we work through, they actually have a sponsorship they do for someone who gets a hole in one on a certain hole.
Okay.
You have to video it to prove that it happens.
Okay.
But that person can actually win $10,000 in cash.
Okay. So it looks like I'm taking up disc golf this week.
Right.
So,
yeah. So
quitting the day job.
Yeah.
Yeah.
So it's pretty cool. It's a big thing, big deal.
Okay.
Yeah. And then just really quick, we do have Battle of the Bands coming up August 19th. We'll touch more on that as we get closer. I know. So yeah, because I have nothing else to do but run 3 huge events in a month and a half.
Right.
So we have Battle of the Bands August 19th, and then of course the big Bedford Centerfest Festival, 6 Block Street Festival throughout the town of Bedford is September 23rd. So
both of those events are great for families, and
we have over 100 vendors signed up. We have Nashville recording artist Glenn Shelton will be here to play from 4 to 6. And lots of food trucks, new food trucks. We have like a Maine lobster food truck. We have lots of different kettle corn vendors, a new hamburger vendor, lots of cool things.
Is the lemonade stand thing coming back?
A different one, but
different one because those lemonade.
Different
stuff.
one, but yes, they're coming back. We are bringing back the petting zoo, hopefully the pony rides. Lots of fun happening.
And you never know do we know who all the other bands are going to be yet? I mean, you never know. I could show up and. I used to be in a heavy metal band.
Well, we haven't announced the Battle of the Bands yet. As far as the other bands coming for Centerfest, Hunter Overstreet is coming back. He performs every year. Yeah. He's kind of a fan favorite. So he'll be back to kick off the day. Last year, we had a band that played in Battle of the Bands. They didn't win, but they were called Blueprint. It was some young high school students.
Okay.
They were phenomenal.
Oh, they were good.
So we asked them to come back and play for Centerfest. So we're working on their time slot.
And they were high school kids from Bedford.
No.
Cave Springs?
No. They were from Roanoke. I want to say Cave Spring.
Okay.
I want to say Cave Spring.
Wow.
This year we do have a Liberty Liberty High School band playing. So I'm excited to see that. But and then the winner of Battle of the Bands plays Centerfest. So we kind of have to wait and see who that's going to be.
I gotcha.
Anyway, lots of fun, lots of things to do in Bedford. So if you're listening, get them on your calendar and be ready to come out and have a good time because everything for the community is free. I'm going to say it again.
That's my favorite price.
I'm going to say it again for those in the back that didn't hear me. It's free for you to come and attend the health fair, Battle of the Bands, and Centerfest. Costs you nothing to get in. We want you to take the money that you would normally spend on admission and put that money into the vendors. We want people to our local businesses to make money those days. Our food trucks, all those people that have
And
put
there's
their
lots
artisans
of
and
craft
crafters.
vendors
Yeah.
and things at the
Yep.
Centerfest. I tried to say Battle of Bedford, but that's not it.
Whatever.
At Centerfest, I actually did some Christmas shopping.
Battle of
this year.
Centerfest.
The Battle of
with
Centerfest. That's
all
what
the
we're going to
things.
call it. We're going to put Woody at one end.
Yeah.
He can be on the east side. I'll be on
Sell
the west
tickets
side.
now.
So we'll start going through.
But
so.
yeah, so that's what we don't charge admission because we'd rather you spend it locally. So
Yeah. That's
um,
awesome.
make sure it's on your calendar because it's got stuff for kids at every single one of them. You can't say there's nothing to do
Right.
between August and September.
Yeah, that's very true.
So now let's dive in. Speaking of health fairs and all that,
Into one of our favorite members, Kaya Health.
Kaya Health. How are you doing since we've last seen you? It's only been what, a month?
A month and
a half,
change, yeah.
maybe? Yeah. So how are things going? Anything new? Anything new developing over at Kaya Health? since
Oh,
we
always.
met?
Yeah.
Okay.
Things are going good. It's been great to find an opportunity to like help the community. And when I say opportunity, meaning there's a lot of openings for help. And
Mhm.
so because of that, we've just been able to help fill that gap. And that's been really rewarding. And so one of the things is I brought Diane with me, Diane White. She's a nurse practitioner. She's been doing women's health and hormone therapy. And then we're bringing on somebody else who's done the same really extensive training that she has done, Sierra Sanford, and she is starting next month.
Mhm.
Yeah.
Very cool. Now, so for those that are listening that maybe didn't listen to the last show, I want to kind of do a quick overview of Kaya Health and
Yeah.
kind of the model and what that looks like. And then, kind of get into all the different things that y'all offer there. So.
Yeah. So any particular questions? I don't know if you got questions after the last.
Well, I know, I guess maybe just to start off, like for those who don't know, like Kaya Health is not your normal doctor's office that you go to. So kind of explaining what Kaya Health is and kind of how you got,
Yeah.
got it started up and
Yeah. So the origin story and the short version of it is I got 20 minutes per patient. Life was okay. That's what they train you on in residency. That's still fast. And then things changed in the world. And then I got 17 minutes per patient because insurance was paying less. And so the boss man said, we just need to see more patients. And so we did. And not of fault of their own. It was just the nature of the beast. And then it dropped to 13 minutes and then 11 minutes and then 9 minutes per patient. I was running around with my hair on fire for a year and a half. And I just felt like things were falling apart at the seams. And, being the change you want to see in the world.
feel like you got hit by a train every now and
Yeah,
then.
right. Right on cue.
I'm gonna throw it in there.
But yeah, started a practice, and it was based off of a bunch of things that my patients complained about, and I
Mhm.
listened to them. One of them was we hate waiting for the doctor for 25 minutes in the waiting room and then another 20 minutes in the exam room. So, we've clocked 45 minutes of our lives just sitting waiting for this guy that is going to charge us if we're a few minutes late
Mhm.
and or send us back home, something like that. And so these are not my decisions to do that, but and so I didn't build a waiting room, and so we don't have a waiting room. When patients come, they're in the back within 2 minutes. I used to time it, but stopped.
Okay, so I'm gonna stop you right there just for a quick question. That's one thing that somebody did ask me when I was
Yeah.
talking to them about your model was how does that even work? Like how do y'all make that turnaround or get them in so quickly and be able to meet with them? Because I guess they're used to having to sit, so they're like, how is that different? Like how do you make that different?
So there's a lot of differences that come together to make that one thing happen.
Okay.
Like a gajillion. But on the surface is we don't take as many patients. So the average family doc nationwide takes somewhere between 2,500 and 3,000 patients. We take, and here it's on the higher end locally just because we have a dearth of docs.
Mm-hmm.
And we take 600 patients and we cap ourselves at 600 patients. And so it's a fifth,
Okay.
give or take, of the number of patients. So in many ways, we just have more bandwidth.
Gotcha.
Mentally, emotionally, time-wise, all the things. And so before I used, and it's very common, I would have appointments double booked and every once in a while triple booked. And I was hoping I wouldn't have somebody sitting in the waiting room talk to the person next to him and say, hey, who are you seeing? Dr. Anderson, what time? 3:30? Me too. I was thankfully people aren't very chatty in the waiting room. But yeah, and so we don't do that. We say,
okay.
come at 10:30. They come at 10:30. They're seen at 10:32, and that's how it works.
On average, how many patients do you guys see a day?
So for me, I'm full time. Diane's part time, full time. She works really hard for a part timer. But I see about 10 to 12 patients a day.
Okay.
So appointment times are either 30 minutes or an hour.
Gotcha.
we get
So on
a
average,
lot more
37
time.
minutes if you look at the numbers over the course of a year. And so, yeah, we just have quite a bit more time.
Okay.
No more. You were talking on the last podcast about your 8-minute lunch, and
Yes.
and so I'll talk a second about the work-life balance. So I also don't want a doctor that's like having to eat on the run kind of thing and has time to stop and take a mental break for themselves during the day. So now you actually have time to, I hope, more than 8 minutes to be able to eat lunch and kind of process and kind of re-energize for the afternoon.
Yeah,
as
or take
opposed
my
to-
lunch break and come do a podcast with cool
Right.
people.
Right, right. I mean, that's a cool thing all the time. So
Yes. Yes.
so I like it so much I do it every week.
Now, I love, and I know we've talked about this, and I personally, like, I have a doctor that I go see, and I'm one of those rare cases, I think I can say I like my doctor.
I do too.
But I love your I love the model you have.
Yeah.
So I'm also one of those weird people, and I think I was telling y'all this last time, like, so I go to a doctor, my youngest daughter goes to a whole different, like,
Different
doctor.
practice.
Different
everything. Yeah.
practice. My husband goes to a different practice, and then my 2 oldest kids go to a different practice. Like, none of us are at the same place. It's so sad.
Well, at least they aren't double booking a family at the same time because y'all would talk.
Yeah. Well, I did. Well, I did finally move my littlest one over with me
That's good.
recently. But I've looked at like moving over to the model you guys have, because I think it's still like, for instance, she woke up today not feeling well. She wasn't feeling good at all. Sore throat, stomach hurt. And so, of course, I get up this morning, I call, and they're like, well, there's nothing available. She can't come in
Right.
today. Well, can you see her tomorrow? Nope, we don't have anything available tomorrow. But you can call us back and see if anyone cancels, or you
Right.
can keep
Yeah.
calling and keep calling, or you can just go to urgent care. And I'm thinking to myself, like, there's got to be a better way to do
Right.
this, because when your kid is sick, the last thing you want to do is wait days.
And it's not
For
a,
them to
a
be
child
sick.
being sick isn't necessarily urgent care appropriate, but if that's your only option, I mean, that's one of the reasons they're so busy and you're waiting so long at urgent care. Because I don't know if you try to get into urgent care.
I didn't even
force
mess it.
people,
Yeah,
it's
take some
it's
Dayquil and go on about your business.
if you don't hit it at 8:00 and get on their list, you're walking in at 4:30.
Yeah.
So
But I love that y'all also have the telehealth piece of it.
Yeah.
Yeah.
To what you do. So, potentially if I had called and y'all couldn't have gotten her in today for whatever reason, I still could have maybe been able to say, well, hey, can I just chat with you a little bit about her symptoms? And maybe we could have gotten, something from
Yeah.
that too. But I do love not feeling like I'm constantly being rushed out of a room. Like, I think that would be such a welcome thing, because a lot of the places I go especially like with my kids, it's in and out like this. And I don't feel like they've really taken the time to look over.
right.
I mean, to the point where like my daughter, my 11-year-old, she suffers from severe migraines, and I'm talking 2-3 times a week, like debilitating migraines.
That's rough.
And it's so bad. It has taken me a year for them to get the pre-auth over for me to even take her to neuro.
Right.
And then I have other people just trying to help me out. Like, she's goes to see a chiropractor. Somebody was talking to me yesterday, and I hadn't even thought about this, about getting her tested for alpha-gal, because they said potentially
Oh,
something like
yeah.
that could be
For sure.
causing it.
Yeah.
She's lactose intolerant. I mean, she's just a whole mess. But
Right.
Yeah. So, Mike, you were talking about
Yeah.
urgent cares. I mean, you see a doc, and that doc sees that patient once, and there's like zero continuity. And from a medical standpoint, you need to see things change over time. So,
Right.
your daughter, you start to recognize patterns as the physician and say, she gets it when this is going on in her life, or that is not going on in her life. And urgent care doesn't get to see that
Mhm.
over time. And that makes all the difference
Right.
in taking care of somebody, just speaking from a physician standpoint.
Yeah. And that's what I kind of need, is someone who I can do that to. Because I even feel now, like, even where I'm at, it's like we're just doing the same thing. It's like we go in, okay, let's refill her prescription. How's she doing? And I just, as a parent, you see all that, it makes you nervous. Like,
Yeah,
you
it
want to,
does.
now my husband, he just won't refuse to go to the doctor. I'm just like, all right, well,
That's
whatever.
I won't say that's all men, but that's a lot of men. So I am not like that because, didn't go to the doctor for 3 years and then went, and then they're like, oh, you have this wrong with you and this wrong with you and this wrong with you. And I was like, oh, and now it's like, I'm like, when's my next doctor appointment? Like, I'm kind of ready to go back and make sure everything's on track, you know? So, yeah, it's definitely it's hard to, if you haven't been to the doctor in a while, it's hard to kind of break the seal and make that first appointment go back. So
now at Kaya Health, you guys have different, it's not just medical. I mean, y'all nurse practitioner, y'all do lots of different areas of medicine there. Like what are some of the other things? How many trains are coming through today?
all of them.
Like, I mean, who's got deliveries? You know what? It's Amazon Prime, so they're shipping all.
It's the Prime Day.
It's Prime Day messing me up.
They're pulling up with all Woody's things he ordered.
I apologize. So, like, what are some of the things that, aside from just coming in for a normal, like, just doctor's checkup, what are some other things that people can potentially move over to Kaya Health?
I do a lot of GYN, like Dr. Anderson said. So we can do mainly all of that in your standard GYN care. I'm trained to do IUDs, so we can do that in office instead of having to refer out for that. We do, like, again, Dr. Anderson mentioned a lot of things in terms of kind of like specialties, but hormone therapy, which is extremely expensive, in most places is very affordable for our patients, which is really important because one of the things is the root problem that we're able to get to because we have more time with the patient. And we are also seeing them hopefully throughout the years. And so we get to know the patient really well. And so hormones are able to come into play in terms of preventative medicine. So the aging process and things that happen because of the aging process, hormones are really, really good for prevention in those areas. But also I work a lot with PCOS patients, polycystic ovarian syndrome.
Okay.
I have a lot of those patients. And that's a time-sensitive syndrome, disease, whatever you want to call it, because a lot of those young ladies are being told, you'll never have kids or you're not going to lose weight, just deal with it. And they get very depressed. It's a really hard thing to have. It's really common. Yeah. But it's a very depressing, hard disorder. And so if you can get that patient and treat the whole person, you can turn a lot of those things around. I think it's, on 8 babies, there was just one born this December that was said never could be. So you can't promise anybody that, but if you can work with the whole person, you sure can raise the chances of somebody being able to live a quote normal unquote life, outside of whatever it is they're struggling with. So it's very rewarding.
You know what else I also love about the concept of what Kaya Health does is that you're not seeing 6 different doctors and 6 different specialties. You've got all these different things to juggle because for me, I know it's like, okay, if I go to my regular doctor, then I have to schedule a gynecology appointment. And then, let's say you have this going on over here with allergists and, infertility. And then you're going to all these doctors. And like you were saying, Dr. Anderson, you don't have anyone that you feel just knows everything about you. Like they can look at something on paper, but they don't get to know you as a person.
They're just getting a piece or two of the puzzle that is you. Like they're only seeing a couple of the pieces instead of the whole picture.
And again, clinically speaking, it is a puzzle. We need all the help we can get as docs. But that was one of the things my patients before complained about. I don't like it when I see a different doctor every time. And so that's one of the things that we made a tenet of the practice is you'll see the same practitioner every time. And then we went one further and said, you'll pretty much as best as we can guarantee see the same nurse every time. And so your phone call, another thing that people complain about is I don't get somebody clinical on the phone for 30 minutes. Like our time was for real 30 minutes. And it would usually be a nurse. And so we have the nurses answer the phones and they answer the phone specifically for their patients. So we've got it all routed. So, if you're a patient of Diane's, you get routed to Diane's nurse. And so there's a lot of continuity that happens in all these nuanced things that I didn't even know about when I was in the industrialized model of medicine, that you can just take so much better care because the nurse sits there and chats with them for 3 to 5 minutes and says, oh yeah, and she forms this great rapport, but also this like clinical picture that adds to what you as the practitioner sees in the office. And it's so cool to see things resolve before they even really get momentum because of that. Yeah.
Well, that's one of the things, like I know as a patient, like if I call somewhere, especially if I'm calling somewhere new or if I'm calling somewhere, let's say about my daughter and, someone picks up the phone and you start telling them your story and they're like, oh, well, you need to talk to so-and-so. And then they send you over to so-and-so and then they're like, well, what do you want? Well, then you got to tell the whole story again. And then it's just, it's nice to know that you can call somebody and just be like, hey, it's Heather Alto. And they're like, oh, okay, I know who you are. I know what's going on. And you don't have to go dive, into major details about a lot of backstories. And because they're going to be able to, they know, especially if it's someone that sees you regularly.
Right.
Yeah. I think that's important.
It is.
Mm-hmm.
Yeah,
so
the nerve-wracking thing being in the traditional model, because I'd be on the weekend and I don't think I ever got a call from one of my patients. And so you get a call from somebody and they've got an issue. You got to go through their whole chart, look it up, try and figure out who this person is. Now, if I'm out of the office and my nurse, Carrie, who's amazing, says, you just give Diane a call, and they call or text me, I know exactly who they are. I know their whole story. It takes a couple minutes compared to could have been hours.
You don't have to assemble the entire puzzle before you try to help them.
Yeah,
You've already
know
know
who
the
they are, and
pieces.
it's
You've
quick
done
for
this
them.
puzzle a bunch of times, so it's easy to try and figure out what the problem
wonderful.
wait, I want to go back to something she just said.
is. What'd she say?
So she said that Carrie, your nurse,
Carrie, my nurse,
may tell the patient to just give you a call.
Yeah. So
like people can actually just call you versus like, oh, you have to wait for the nurse call back. And then like, you don't ever really speak to the doctor when those situations happen. It's a lot of times being relayed back. And
You've got to wait 3 to 5 business days.
Yeah. Well, half the time when I call and it's always like, if you're calling for so-and-so, like the nurse, and then you get the voicemail, it's like, hi, you've reached the nurse of so-and-so. And if you call after 4, we won't get back to you until, 2 days later. No, I'm just kidding. But, you put all that in there. So it's just nice to hear that.
Yeah.
You have that direct connection as well, which is important. And a lot of times, and like you said, when you said on the last podcast, when you started that you were really nervous, like I'm going to spend all my time on the phone. And then you said, because people have access all the time, they're going to reach out during business hours. But if something does happen after hours, they have the comfort of knowing they can reach out to you.
Yeah.
And you said that your phone doesn't really blow up a lot, that it's just, a text here and there kind of thing. And
yeah, it's pretty good because we can usually handle most things between 9 to 5.
Yeah.
And let me just put a disclaimer out there. I'm not knocking certain doctors or doctors' offices like around here because, again, I love my doctor. Well, he knows I love him. I love my doctor. But what I'm saying is I feel like it's the system. It's not necessarily the doctors or the nurses.
100%.
It's the system. So that's what, let me just put that out there before I get hate mail or something saying I'm being, crazy to doctors' offices in our area. I'm not. I'm just
I'll
saying.
Just delete this email.
I feel like there's probably a lot of doctors out there that feel the same way that you feel.
Well, yeah. I mean, I have a few stories just to that point. I mean, wonderful patient. Saw her at my old office, and then I saw her at my now new office. And I felt some lump and on her throat, and I was like, "How long have you had this?" And she's like, "Oh, like a year and a half." And I was like, "I've been your doc this whole time," and I'd only had my practice open for like 3 months at that time. And so I was working with her before. I was like, why didn't you mention anything? And this is what she said. She goes, well, doc, that was on my B list and I never had enough time to make it off my A list.
Right.
And that was sobering right there. And there's many experiences that have happened like that where I saw a patient before in the old practice and then I see them in the new practice and I'm able to take way better care of them. And the only thing that changed is the system. Their doc was the same. And that's kind of sobering in and of itself. Too, because I did my best before, but my best was much smaller than my best now.
Right.
I mean, if you imagine taking a timed test, you're going to do however well you do. But if you take the same test and you remove the clock, you're going to do better. And that's kind of how we feel now. We just feel a little bit like we have a superpower just because we have more time to digest and put together this puzzle.
Mm. Yeah. I like that analogy too. I didn't think about it that way, but yeah. That's good. Now, so for those that maybe, again, are just listening in this week, tell us a little bit about how the system works, like the payment and like how they become a patient.
Oh, yeah. So I think the way I explained it last time was like Netflix for your health.
Right. Yeah. I like that.
That's kind of what it is. It's a monthly fee. You can look at it in the same way as you do a gym membership. If you need us a lot, we're there. If you don't need us a lot, we're still there. And it's just a monthly fee that doesn't change. And that's pretty much it. We take a lot fewer patients so that hopefully when you call, we can get you in a decent amount of time. And so we also give, because we just don't take as many patients, the docs have more bandwidth. So if like today, my nurse said, "Hey, this patient called. It sounds like he just needs a quick call. I don't think he needs to come in. He's feeling kind of sick. So maybe you could just handle it over the phone." And I did, and he was very grateful. And we took care of him, took care of his work note, that sort of thing, because I'd seen him last week for it. And it changed a little bit. He had a couple questions. It was a 4-minute phone call, and that was it. And so we had the ability to do that, and that was really cool.
That is cool.
Yeah. And see, I think it's I know there's some people that are like, oh, well, they don't take insurance. Well, no, but I feel like this option gives you kind of the best, because there's a lot of people that still have insurance and still come to your office.
Right.
Yeah. Over 50%.
Right. And they can use that for other things, because if they have to go to the hospital, if you have to go to something, I know back when I was looking into it, somebody was talking about getting like, what is it, catastrophic? So like, that way you're covering this level, but then like you have that catastrophic insurance. So if like something major were to happen.
Right.
Yeah, and catastrophic insurance doesn't really exist anymore.
Yeah, okay.
Not with the onset of
it's been a while.
The Affordable Care Act and things like that.
Okay.
It doesn't really exist anymore. Not the way it did like in the 80s and early 90s. But now we have a lot of patients that do like a cost-sharing ministry type thing, if you've heard of this, like MediShare or something like that. There's a whole bunch of different companies, but that's ones that people are familiar with. And so that is kind of what catastrophic used to be 35 years ago. And they do that. And even we've worked it out so that some of these companies, they let them know that they work with us, and that company will give them a discount on their monthly rate, because they know that we statistically keep people out of the hospital, the ER, specialist office, et cetera. And so it saves them money.
If you look at it like a car, if you get your oil changed when you're supposed to, and you maintain the tires and you do everything else and you do all that work throughout the year, you're less likely to end up broken down on the side of the road and needing tow truck and emergency service, all that stuff. So it's
ooh, I like that. I might use that in the future.
Go ahead.
Copyright Mike.
$62.95.
And we actually do for the community. We do discounts for businesses in an effort to help businesses be more successful.
Right.
Because if you have healthy employees, then they turn up to work more often. So if businesses in the community are interested, we do offer that a discount for the business.
Well, that's a great segue.
Oh, there we go.
Good job.
We planned it.
So that's one of the things I am really excited about coming into the last quarter of the year. I think with the partnership we're going to be, the Central Virginia Business Coalition is going to be doing with Kaya Health. We're always looking for benefits and ways to help small businesses in our area. And as most people know, for a small business, it's really hard for small businesses to cover insurance for their employees.
I do research on it every year, and
it's a lot of money.
It is.
And a lot of small businesses just don't offer it anymore. Or if they do, it's at an astronomical price to the employee, because they can't afford to offset.
And the business as well. So
correct. So we are going to be partnering with Kaya Health to actually bring as a benefit to small businesses in our group the opportunity to enroll with Kaya Health your employees at a discounted rate for the first year.
Yeah.
And I think it's very affordable, and it's definitely something that you can choose as the employer to pay yourself if you want per your employee, or just offer it as a rate to your employees to take part of,
or even split it with your employees,
or however, that
because that's something we're looking at where because we feel like if our employees have a little skin in the game and pay for part of it, then and we can still provide some benefit that they'll use it because they're paying for it. We have quite a few things that we offer that we pay for fully, like Teladoc and things like that, and the use isn't quite there because they always forget about it because they're not having to pay out any money for it every month. So
and it's way cheaper if you do it through the CVABC.
Yes.
We like what you guys do, so we wanted to add to that. And also, all of a sudden, I find myself being a small business owner, and so I started to recognize all those pinch points that us small business owners have, and recognize here we are perfectly positioned to help one of those.
Yeah, and I know we're basing it on the number of employees you have in your business. I think we have, and you're going to correct me, I don't have my sheet with me, but I think it's like 1 to 5 or 1 to 10.
1 to 9.
1 to 9, yes.
Yeah.
And then 10 and up.
Yeah.
is a different rate. So I think where it's normally 90 a month, if it's the more than 10, it was going to be
75.
75, and
Yep.
then the 1 to 9 is going to be 80.
You got it.
Yep. So
Yeah, it's not bad.
so you're saving anywhere from $10 to $15 on that monthly fee.
Which if you've got 10 employees, that's $100 and some dollars. So that's
Well, not only that, and this is one of the things that we, had talked about when we sat down to go over this, is that not only is it going to help your employees, okay, and it saves some money, but it also is a benefit you're offering to keep employees
Right.
employed with you, because that
That
is one of the
has-
biggest
yeah.
things. If you don't offer benefits, it's tough.
or if you just don't keep people healthy, because
Well, that's true.
a lot of times
There's that.
It's true.
you have a health issue come up, and if you catch it early and you can treat it early and kind of change some habits to help that condition, it can make a world of difference,
Yeah.
as opposed to waiting until
Yep.
it's time to go to the hospital kind of thing.
And the other great piece to it too is we have a lot of members that are just themselves.
Right.
Yeah.
And they can sign up and get that
Totally.
discount and,
Yep.
and take advantage of it. Now, they also offer like couples and family rates. And so basically the way that would work is they would pay the difference in that cost, I think, if they wanted to add on more. Is that how we
And it
had
really
looked at
depends
it?
on the employer. If the employer wants to say, hey, I'll cover your whole family, then we do have some that do that.
Yeah.
And so most of them say, we'll cover our employee and then you can pay the excess for the
Right.
rest of your family.
Right.
And because we dropped the price so much, I'm a family doc, so I like seeing families. We dropped the price a lot. So it's $32 per person per month if you have like a family of, say, 5.
Mhm.
Actually, I think it's 38 if it's for 5. Yeah. And so if you have a really big family, then the cost per person comes
It
down even more.
It makes it a better value.
Yeah.
Well, and you look at it, let's say you go to the doctor every month for something. I mean, I have to go to the doctor every month. And occasionally, if someone's sick, I have to take Riley at least every 2 months because she has to get re-upped for her, medications and things. So you're paying $25 here, $25 copay there, $25 copay here. If you're a family of 5 and everyone goes to the doctor in that 1 month, you basically just paid for your
And
Yeah.
if you get labs, you get a bill later,
right.
not when you go to the doctor. And that's one of the things I like about you guys is you've got your lab rate so low,
Insanely
is-
low.
Yeah.
affordable. So
Yes.
I actually had someone from my office listen to the last podcast. He
Yeah.
was facing some medical issues. We're like, I don't know what to do. And I'm like, well, hey, I just did the podcast with
Sweet.
Dr. Anderson, and I'm going to read a short thing
Yeah.
from here. I have a long thing too that we'll do if we have time. But he said, in Kaya Health, I found a fellowship of healers united in their dedication to my well-being. Together, they forged a path of accessible care where the darkness of waiting rooms and insurance woes were left behind. With Kaya, my quest for better health became a journey filled with compassion, support, and the promise of a brighter future.
Can he just write something nice about
Whoa.
me too? Like that was cool.
Yeah, he's
well written.
Well written.
he's responsible
Yeah.
for all the emails and text messages to clients. So he has
Does he have like a thesaurus on his?
Chat GPT
Ah.
or whatever. So
Gotcha.
he runs everything through that. So, but yeah, it's
That's awesome.
But I love the where the darkness of waiting rooms and insurance woes were left behind. So
That was really cool of him.
that should be your
Thank
catchphrase.
you.
So yeah, but he went about right
Put
after
him in
the
a
other-
cape.
yeah, right after the other podcast, he was looking into it. And he goes, "This can't be right." Like he was very skeptical of like,
Yeah.
this isn't really how it works.
We
And-
get a lot of that.
yeah, and
It sounds too good to be true, so it is.
he went through the sign up
Mhm.
process, I believe, on your website, and then
Yeah.
went in and talked to somebody, and he had met with someone and had lab work done, and he was like, it was like $140 after the lab work too. Like,
Yeah.
he couldn't believe that it was so inexpensive
Oh, that's neat.
for the first month. So he'll most likely be a patient for life. I'm just saying because
Mhm.
he was talking about how great it was this morning. I actually had him send me this morning. So, but
Oh,
he was
glad we
bragging
could
on you
help.
guys too.
That's
So and I told you when we came in before we were on the air, like it's great to hear you talk about all these things. Like there's no waiting room. Like it's you're in and you're back and talking to somebody. You've got all the time you need. Like he went through an extensive like what he was facing and things like that. And he was like it was all true. Like it's good to know that it's not just like we're
Yeah.
Mhm.
not like the used car salesman. Come see us. We've got the greatest deals in town, and it's like, well, do you? So, but it's good to know that what you say is backed up by someone that I not
Oh,
only
that's
know,
really
but work
neat.
with every day. So it's great to hear.
Mhm.
So
Well, one of the things too, and we were talking about just a few minutes, I was talking about like paying copays, and I don't know if this has been mentioned, but and I don't know if somebody listened was just like, well, don't I have to pay a copay when I come see you guys?
Mhm.
The answer is no. Like you pay that flat fee every month,
Mhm.
And you could go see Dr. Anderson 5 days a week if I guess he had the time.
You could put up with me that much.
If you really had something going on or issue after issue. Because I know, I feel like I just tell all my stories on
You do, but that's
whatever.
okay.
But I know, like my son, he's 23 now, but when he was a year old, he was really sick. And so for 5 days straight, I took him to the doctor. 5 days of $25 copays, everything. And then he ended up having a febrile seizure because he got, really heated, and then it came down. And it was not a good time. And like, I refused to ever go back to, we left that practice like immediately because they were like, they just didn't even inform me. You know what I mean? Like I didn't have any, but that was almost, $125 right there. I had paid in copays going to see them every day and really got no answers for anything. So that's kind of what I'm trying to say. Like, you could go and see them and then you're not paying anything.
Yeah, and a lot of it we cover, like, if you need a strep swab, we had a kiddo come in and the mom was like, hey, I think he's got strep, cousin did, come by, we'll swab you and send you home and we'll call you with the results. So you don't even have to have a cranky, sick toddler hanging out in a waiting room or even in the exam room in the back. And so there was somewhere I was going to go with this and I forgot.
So basically what I'm getting from your story is that like, so when you have a child that needs the strep swab, you don't have to do the whole appointment. You can do the rest of it over the phone and things like that. Come in, do the swab and go.
I remember now. Thank you, Mike.
You're welcome.
Nice save. But yeah, what Heather was saying is like, if you need stitches, we cover that. If you need a joint injection, we cover that. The medication, the needle, the syringe, all that stuff, we cover that. If you need a mole removed or a biopsy or, something like that, we cover all that.
Wow.
But that's a nice thing what you were saying, like with when you might need to go see somebody really often when you first get started because you never got to your B list, your C list, or your D list before. So it might be really a lot of appointments in the beginning. But because of the model that we use, hopefully the goal is we get to you to where you're so well, you don't need us a whole lot. And that's because you're doing so well, not because we don't want to see you, but that's the whole thing is we get you well, we get you running the way that you should be. And then we work on preventing that happening again. Yeah. And you can only do that if you're seeing somebody who knows your history, because otherwise you're just repeating every time you go in, seeing somebody different, starting all over, So
another thing I think I would mention to people out there, wherever you are
in the podcast,
is that let's say your company doesn't offer insurance for health insurance, but maybe they offer an HSA. Put the money into the HSA, and you could actually utilize that to pay for your monthly doctor's membership, right?
Yes.
Can you?
Yes, kind of. Yes. It's one of those, like, the canned answer is ask your accountant.
Okay.
To make sure that.
Because I know you can use it for medical stuff.
Yeah. Yeah. It's one of those, it's nuanced. But the short answer is yes, but ask your accountant.
Yes, but make sure you do it the right way.
Yes.
Make sure you.
Exactly.
Make sure you get a
I've never heard of anybody fined or anything for that, but the canned answer is ask your accountant.
Okay. Well, because I know you can use it for copays.
Yeah.
So I would assume, like, if you're
it's just a monthly copay.
Okay, don't listen to Heather. Heather doesn't know everything, but I'm just saying, like,
that's the rule I live by.
I mean, I just know, like, I have a family member that got a Peloton through their HSA. Like, they were able to buy a Peloton, and I was like, what?
Yeah.
Like, I need an HSA account. I need to get a
So funny story about that. We had our dog we thought needed surgery last year. So like we're scrambling, like, it's going to be like a $2,000 surgery, whatever. So I'm like, okay, so I go get Care Credit because you can use that to vet all that stuff. And then I start getting these emails from Care Credit saying, hey, you can get a Peloton if they're on sale, you can get it with your Care Credit. And I'm like, this is for, like, I get it. It's related, but like, that seems like skirting a fine line there. But anyway.
Yeah. Anyway. So. Well, I just thought that, if you're able to do that, if you talk to your accountant and you're able to, it's a great way to save that money and be able to put it into, this form of, medicine.
Yeah. And then it's pre-tax. So.
Yeah.
Yeah, that does help. Something we were talking about was employers. So Julie, who was here with me last time, has been doing a lot of work in the background. And while we offer the monthly fee where we take care of all the primary care stuff that person needs, the employee in this case, for somewhere between $75 and $80, we also have started working with one of these cost-sharing ministries. It's a non-denominational one. And for you can get insurance, essentially catastrophic insurance, what it used to be, on top of us. So the whole combo would be, I think it's $260. It might be a touch less than that, where we take care of you. You get like red carpet primary care. And then after that, heaven forbid, you go to the hospital, you get hit by a train, whatever happens, it picks up and it does it for just so much cheaper.
Wow.
I mean, for a similar person, if they go through the marketplace, through the ACA, it'd be about $850 to $1,200, depending on a few ways that you answer questions. And so to have it for $260, I mean, it just makes it so much better for employers and therefore employees.
Now, do you have, and I don't know the answer, this is a true question. Like, do y'all have a pharmacy, or do y'all do anything with pharmacies to make prescriptions any different, or?
Yeah, so I did for a while. It was a project that I gave myself during the beginning of the pandemic, because I'm just sitting there in my office and nobody's coming in.
Right.
And so like, no, let's do this. But the state of Virginia makes it pretty hard to keep that up. So I didn't. But what we do with patients is we've talked to a lot of the ma and pa kind of pharmacies in the area, and they can get it for cheaper in many cases for folks, even than insurance. The wild thing is we've had numerous patients reach out to us and say, hey, wouldn't you believe it was $147 for this medication for 1 month with insurance. And then I did your little trick that you talked to me about, what is it without insurance and what is it with GoodRx or something similar. And it ended up being $7.85.
Right.
And the other one was, quote, with insurance. And so sometimes it just doesn't make sense. American healthcare.
With insurance, a lot of times it doesn't make sense. So.
Well, I'm just going to say, I also noticed, because I was on your website earlier, that y'all now have a massage therapist. So Heather's going to be scheduling that.
She's phenomenal
soon.
too.
She's
As soon as she gets off her private jet, she's headed
Yep.
there.
I'm going over there. Yeah, as soon as I get off my jet this weekend, I still need some relaxation. No, that's one thing. I love you. The massage clinic, y'all have a depression clinic.
Yeah.
Which I think a lot of people are
talk to me more about that
depressed.
depression.
I don't want to say depressed, but I think there's a lot of people walking around that don't even realize they are.
There are a lot of people out there that are dealing with depression.
Yeah.
I think that's
that's the way to say it. Good, Mike.
So this is something that came out of a need that I recognized, and also an opportunity that I also recognized. And so my whole family went into psychology. My dad, my brother, my sisters studied it in college. I mean, everybody went into it except for me and mom. She's a second grade teacher in Richmond. And so what happened was, in medical school, you get taught, and this is generalizing, like somebody's sad, you put them on this kind of medication, an SSRI. And okay, that's it. You're sad, you get to try this medication. You try it for 4 to 6 weeks. If it makes you sadder or throw up or gain a bunch of weight or, whatever, then we'll try a different one. Or if it doesn't work, we'll try a different one. And you put them on the same drug class, different medication. And again, I'm generalizing. A lot of docs do much more than this. But that is generally how you're taught in medical school. And so being in the practice that we're in, having a little bit more time, talking to patients, there's one situation, and she's okay with me sharing this, is she was wildly depressed. Just terrible. And things were rough with her husband and her children and her job and every aspect of her life. And there was one point where I was like, we've talked about this a lot. You've tried whatever, counseling and this medication and that medication, and things just aren't. I would like to check some lab work, specifically your vitamin D. And this is because of something else that I'd recognized in the past. Again, a nod towards the benefit of continuity of care. And she said, yeah, but a vitamin D, because that's what my nurse practitioner said at my old office, or where she used to go, I guess, it cost $377. And I was like, whoa. So I checked it, and she was right. And I was like, well, at our office, it's $29. And so she said, in a brief moment of levity, well, you can check it twice then. And so we only checked it once, and it was the lowest that I've ever seen in 12 years of practicing medicine. And I was like, oh my gosh, okay, you and $4 need to go to the drugstore and pick up over-the-counter vitamin D. This is how much you do. And she has never seen me for that since.
Huh.
We're talking like crippling depression.
Wow.
And that has happened with thyroid and progesterone and testosterone and heavy metal poisoning and all these different things that we can check by blood work. And so that is not always the answer, of course, but sometimes we get these situations where people are like, I still feel awful. I've been on 3 medications. I've gained 20 pounds because of it. You know, whatever the story is, it's usually not a fun story. And then sometimes we'll do this large panel of blood work, which we call the Depression Diagnostic Clinic. And if you get it at, you know, a regular place, it's about $5,000. And if you submit that to insurance, insurance will be like, oh, you're sad and you want us to spend $5,000 on it? No, thank you.
Now we're sad and we're going to tell you no.
Gosh, yeah. Like, and not trivializing depression at all, but like that is how a lot of the time, pretty much 100% of the time, the conversation with insurance goes. They're like, we're not going to pay out $5,000 so you can get some blood work. And so it never happens. And so we've whittled it down because this is a labor of love. It's something that I feel passionate about, and we got it down to $475. And so, I mean, it is less than, it's better than 90% cheaper. And so we run them through this large panel of blood work, and sometimes we find things that they never expected, and sometimes we don't find anything. And in both cases, it's beneficial. And we also run them through a panel of questions that help tease out the like psychosocial aspects of depression. That I had some med students, my brother who's a doctor of psychology, and a few other folks help us write, and it works really good. And so we run them through that panel, both blood work and the questionnaire, and then Alice, who runs that. Who is actually who your friend saw.
Okay.
In that email, she runs this, and she goes through both of those panels with them. Mm-hmm. And what she says is, so these can be people just off the street. And she says, this and this and this need attention. You can go talk to your primary care doc, or we can become your primary care provider. And that's how we do it. So,
and on top of that, should they need medicine, we do have a test. Again, it would be extremely expensive in the mainstream. But at our office, I think it's $100, the GeneSight, to figure out which medication they would respond to.
I don't know the price of that one off the top of my head.
It's somewhere around that. It's very affordable, but it's a blood test to tell you what medications that you would tolerate the best. And it makes it really, really nice if you have somebody who needs medication, because you can get most of the time you can get the right one from the jumping point instead of going through 5 of them.
Yeah, because I'm type 2 diabetic, and I went through I think 14 medicines before I found one that worked.
Yeah.
One I took I took one pill the night before, and the next day my father-in-law came by the house, and like he mowed our grass, and he was coming in, and he's like, "Are you okay? Like, why aren't you?" Like, because I never miss work, and like I was half dead, dehydrated in the bed, and so like I had some kind of allergic reaction to it and all that stuff, and it was it was horrible, and it took a long time to find one that works, and now that I found one that works, like I'm not taking anything else. So it can be it's all about which medicine you respond to, even though a lot of them work similarly.
If you need it, it's important to know which one is going to work. And most of the time, that test is very, very accurate.
Yeah.
You mentioned earlier the hormone therapy, but do y'all also do allergy testing in the office?
We don't.
You don't? Okay. I wasn't sure. I was sitting here thinking I need to bring that kid of mine, just get her poked with a bunch of let's find out what's going on with that kid.
We do more sensitivity, so I do a lot with gut.
Okay.
And Sierra, who's coming on, she'll be doing a lot with that as well. So sensitivity, and it could be a very long discussion, is a lot different than allergies, but it's longer, can show up 72 hours after you ingest whatever it was that your body did not like, and that can manifest in skin, psychological, all kinds of different ways that it can manifest.
Yeah.
Okay.
So we do a lot more with that.
Well, it's hard to believe it's already been an hour.
It's 12:52.
I still have things to say.
Because I'm gonna lie so that we can keep talking.
Yeah.
Because Woody can't see the clock over here from there.
No, he'll just start playing our song.
He will. He'll just start playing.
Time to go. No. But tell everyone who's listening, how can they, if they're interested in learning more or interested in signing up.
Oh yeah.
To be a patient. How do they go about doing that?
Yeah. So website, as per usual, it's KayaHealthClinic.com. And so Kaya is Kaya healthclinic.com. And this has been very much a labor of love. I mean, it's something that for me kind of saved my life as a doctor, because I was depressed and suicidal at a point because my job was so rough. And I got into medicine after 11 years of school and a whole lot of debt and just countless amounts of effort. And then I just couldn't take good care of people. And then, so to be able to do that now is a big blessing.
Awesome. Agreed.
Well, and hopefully too, if y'all, make the plans to come out to our health fair on August the 5th, I'm hoping that we will have
You'll
Kaya
be
Health
there.
there. We're going to have a table there. So, if you're listening today and you want to stop and hold on, Mike's giving me the,
Well,
hold on a minute,
I have one
finger.
question I want to make sure we have time
Yes.
for. So we started this last podcast. So tell me, since you've joined the CVABC, what benefit have you seen from the CVABC?
Yes, that's
And why would you recommend it to others?
Oh, that's great. Yeah, because, I've tried to work my way into different networking types of venues, clubs, programs, whatever. And I just felt like I never got connected the way I was looking to. And that happened nearly immediately with CVABC. And so that's why we're a big supporter and why we wanted to partner with them. I mean, we reached out to them to do this partnership because I want to make them stronger and more successful in what they offer. And if we could do that and, help two problems at once, then that's all the better. But I really felt like I connected in a meaningful way in ways that I hadn't the 4 years before where I'd been desperately trying to.
Yeah.
Well, and I would also like to say thank you to Kaya Health because they are our newest community sponsor.
Awesome.
For us as a whole, like not an event, but as a whole, which for me says a lot because it lets me know that they're interested in putting into us as an organization because they appreciate the things that we are able to put out to all business. And, having you guys do that helps us be able to keep supporting everyone. So thank you for that. And you can also find more about Kaya Health at
CVABC.org. CVABC.org in case it wasn't clear.
Thanks, everyone. We will be back next Wednesday with Talk Local to Me.